This is Ms. Yeomans on the third part of cardiopulmonary for Clinical 2. The 3-channel recording capability of the ECG is a nice, easy, non-invasive way for the physician to get a look at our patient's heart on the inside in an ambulatory setting versus over in the hospital where they might could do something more invasive like a heart cath. So our EKGs are pretty simple. We can do those in a short amount of time, typically within 10-15 minutes at the most. That's something that you'll find that you'll actually gain speed on the more that you perform those. So what's really nice about your EKG whenever it prints out from your instrument, the actual graph, is that, as you can see here in this picture, the leads are actually labeled, so you can see which one is your AVR, AVL, AVF, leads 1, 2, and 3. And then you have your chest leads, V1, V2, V3, V4, V5, and V6. So remember down here on this lead, you're getting a whole rhythm, a rhythm strip, if you will. So this is what the physician will look at in the office setting as well as in the hospital setting to get just a nice quick glimpse at what is going on inside of the heart. So this prints out on a piece of paper that's about 8.5 by 11, which is a typical piece of paper that we use even in our notebooks and printer paper. And this is nice because it will actually scan into the medical record very nicely. The EKGs can be stored digitally, or you can scan them into your medical record, and we see a lot of new instruments now that have a Bluetooth capability to upload that picture into the electronic record, so the physician just has to open up the patient's chart and that ECG will be there for them. So it's really nice. He can make notes directly onto that ECG and use those notes to help better treat the patient. Alright, so how does this little machine interpret what's going on inside the heart and put it on this piece of paper? Well, it's a nice little gadget that just picks up all the electrical activity, and then it transposes that electrical activity onto the piece of paper, and the physician is the one that is responsible for interpreting what that looks like. So what kind of information do we need in order to get the right normal ranges for our patients? We've got to have the patient's age, their sex, their height and weight, and then their medications. So we have to be able to list that information into the EKG, the graph itself, so it knows what normals we're going to be comparing to. Alright, so the interpretive portion of the ECG, a lot of times your ECGs will print out with some information here, like this one says sinus bradycardia, supraventricular extrasystoles, non-specific ST changes, and the summary is a borderline normal ECG. I don't typically like to take an instrument's reading. If I see something abnormal, I'm going to report that to the physician, and we're going to look at some of the most common abnormal dysrhythmias, or just basic old dysrhythmias, that we're going to be reporting immediately to our physician. So again here, this is just reaffirming what I said about EMR capabilities and that transmission of data. It's nice when we have it electronically, so we can even send that over to maybe even the hospital if we're trying to share it with them, or even between other physicians. Electric records are just amazing. They're helping us take better care of our patients in the long run. So what are artifacts? Artifacts are abnormal interference that we pick up on the ECG that prevents us from getting a good reading. So we've got to make sure that we can eliminate any artifact if at all possible. So how do we do that? Well, we need to know about what causes artifacts, so we're going to get into that in just a second. It could be that the artifact affects the quality of the recording. We just said that. It can give a false positive to the ECG. And some of those common ones that we will see are the muscle contractions, the wandering baseline, the 60-second interference. And if we don't fix that, then again, it's going to give us a false positive on some of our ECGs. Now, sometimes that electrical interference can come from things that we don't even think about being a problem, such as the electrical activity going on within the building. Cell phones, very common, very, very common. So those things that we can help and make changes with, we're going to do that. So I can take my cell phone out of my pocket and put it across the room, but I can't turn the power off in the building. Those are things that I can't change. It might be that I need to unplug the ECG machine from a specific outlet and plug it into a different one. But we're going to remember some very helpful tips later on here about where to plug in that ECG machine. So muscle artifact is characterized by a fuzzy, irregular line. It looks kind of like scribble scrabble. Why do we have it? Sometimes our patients can have involuntary muscle movement, like a somatic tremor. So some of your patients that have Alzheimer's, Parkinson's, they're going to have that muscle artifact that you can't fix. So you're going to do the best you can to get the best picture for the physician. You might have an apprehensive patient, so they might shake their leg or do something that is just a normal stress relief for them. We can typically look at some patients and see that they're shaking their leg or their foot or their hand, and we know, hey, they're a little bit nervous. They're apprehensive about something. So in order to try to make that go away, sometimes you have to do some extra reassurance and make sure that they understand what's going on. Sometimes that's the scariest thing. It also can be from different types of movement. Sometimes our patients, they just will not quit talking and they will talk your ears off. So you have to be careful when you say, okay, I've got everything hooked up. Now I'm ready to look and see how is this going to look. And you might want to look over at your patient and say, okay, I need you to lie very still, breathe normally, but be very quiet. Don't talk. Just lie there and be still. Typically that gives you a great reading. There we talked about some physical conditions with that muscle artifact. A lot of times people will do it if they're cold. So I have even had to cover patients up with a warm blanket after I have them hooked up, and that helps to keep some of their body heat in, and it helps with that muscle artifact that we will see. All right, the wandering baseline. As you can see, it looks like we've got a mountain that we're trying to climb, but we actually have the rhythm showing up great. We don't want this wandering baseline. We've got to make sure that that is changed. So what can cause it? Loose electrodes. So I'm going to talk with you when we look into the skills themselves about checking your electrodes each and every time that you hook your patient up, and that will help with eliminating a wandering baseline artifact. Okay, some other things that might cause that and you can actually fix would be if the electrode pulls loose from the patient's skin, so you can use a little bit of like paper tape to help it be secured to their skin better. All right, some other reasons we might have a wandering baseline. Dried out electrolyte on that electrode. Believe it or not, if it's out of date, it can cause this problem. So make sure you have good in-date electrodes that you can use that have good electrolyte. Body creams and oils, that kind of stuff. So those are the reasons why those electrodes don't stick to the patient's skin, but maybe they have it on and you get lucky and it sticks to the skin. Well, you got to be careful. If you don't get that wiped off, then it's going to cause a wandering baseline. So what about the 60 cycle interference artifact? It's also known as AC artifact, and it's due to electrical interference. So this may be because one of the outlets that you're plugged into, it's getting some static from the backside. There's some electrical current that could leak out that we want to be very careful of. And how do we fix that? Well, hopefully your instrument will record in your office without having to be plugged in, but if it does, then you're going to have to find another outlet in the room that you can use that doesn't cause that problem. Alright, so think about if you were to plug in the ECG and the only outlet that was in the room was under the bed. That's going to cause some artifact. Please don't do that. Just figure out how to get that battery charged and perform that EKG without that electrical interference. Okay, so this is what the 60 cycle interference artifact looks like. So, ooh, it's some scribble scrabble, really hard and heavy with the deep color of the darkness from the galvanometer scratching on that paper. So some other things that can cause this, like I talked about with the electrical interference coming from the outlet underneath the bed. You also could have some cords that are on the patient's body that you are, maybe the cords are draping over one another and they're vibrating and you can't even tell it, so that can cause it. And then again, the other electrical equipment in the room, so if you have something plugged in, it could actually be causing problems. This talks about a lamp, an autoclave, the actual exam table that's plugged in. So just be mindful, keep looking, try to eliminate that as much as possible. Okay? Alright, one thing that you have to know about the 60 cycle interference that can be causing this is if your machine is not automatically grounded. So be careful of that and see if you've got that problem. Okay, so the interrupted baseline artifact. This can be caused by a metal tip of the lead wire becoming detached from that alligator clamp, and what we have to do is actually reconnect that to make it connect again so it can pick up the information. It could be a frayed or broken patient cable, so it's not picking up the information as it's coming from the patient. And we've got to make sure we eliminate all problems that could be causing this interrupted baseline or any type of interference. Okay, so the Holter monitor electrocardiography is a portable type of EKG that your patient can go home with, and typically the time period that we're looking at is about 24 hours. So they go home, they're recording their electrical activity of their heart all throughout the 24-hour period. They bring that machine back in. It is downloaded, the information is downloaded from that little computer, and the cardiologists have that information to look at for a 24-hour period to see, hey, are they having problems when they're exuding themselves? Are they having problems when they're sleeping, when they're eating, whatever the possibilities may be, and we can try to figure out how to fix their problem. Okay, we try not to have the patient get that Holter monitor wet, and we want that patient to carry on with their normal daily routine as much as possible so we can see what the heck is causing that. Alright, so it's similar to a resting EKG, but it's different. And I'll just talk to you about that. Alright, why do we do these? Some common reasons why. If you have patients that have syncopal episodes, unexplained chest pain, dizziness, where they have a increased heart rate or maybe a very decreased heart rate that's unexplained, we want to look and see why. Let's get that picture with that EKG. Okay. Alright, so the digital heart monitor or Holter monitor, that's the one that most offices have nowadays. So it's more high-tech, and again, we can actually download that information. It's very small, it's portable. The patient typically puts the little device in a small pouch that they can either wear around their neck like a necklace, or they can strap it around their waist and carry it around. Alright, so the patient preparation basically going to be the same as we do for the EKG in the clinic or in the hospital. We want to make sure that they do not use any of those body oils, lotions, all that fun stuff, because it's not going to allow the electrodes to stick to the skin very well. And these electrodes that we're going to use have a stronger adhesive property. So we do want them to go ahead and take their usual medication. Wear some clothing that's pretty comfortable, nothing too tight and constrictive because we don't want them to feel uncomfortable. Okay? All right. So we want the patient to keep a diary while they have that Holter monitor on, so we can see at different times if something's picked up on that reading. We can go back to their diary and see what exactly they were doing. Were they eating? Were they showering? Were they outside mowing the lawn? Whatever it was, so we can try to figure out what the heck's causing their problem. Then there's another type of Holter monitor that's an event monitor that they wear, very similar to the regular Holter monitor, but when they start to feel that unusual feeling sensation, they hit the button and it records what's going on at that time. And this is something that's very important because oftentimes the patients never have those symptoms while they're in the office. So guess what? We got to send them home with this Holter monitor so we can figure out what we can do to make them better. So again, the cardiologist is the specialist that will interpret all the readings from the ECG, and then we will actually get a result back that we can relay that information to our patient. Typically the physicians, if they find something that's abnormal, they will ask that the patient come back into the office so they can go ahead and take care of that. Or maybe it is that they might not have let the patient leave when they turned the monitor in, because sometimes we can pick up on that pretty quickly. Alright, so let's move into the big portion of this chapter, which is the cardiac dysrhythmias. I'm going to stop the lecture here and start a new one for the dysrhythmias.